The instrument cycle starts in the OR. In the past, the OR team processed the instruments decentrally in the OR. Today, RUMEDs are central. They reprocess all medical devices of one or even several clinics in one place. However, the reprocessing of instruments still begins in the operating theater today. First, the surgical nurses and caregivers remove coarse dirt. They then place the instruments open and disassembled in a tray. This is followed by transport to the central RUMED. The RUMED staff accepts the medical devices from the OR and starts preparing them for cleaning and disinfection. The employees have to sort the medical devices and possibly also pre-clean them manually before placing them on suitable instrument carriers. In some cases, disassembly into individual instrument parts is also necessary. The employees follow the existing standard operating procedures, which are essential for a successful process. In addition, however, medical devices are becoming increasingly complex. They are becoming more multi-part and the variety of materials used is increasing. As a result, the workload and demands on the specialist knowledge of RUMED employees are increasing. Once the preparation is complete, the machine cleaning and disinfection follows. Particular attention must be paid here to the correct loading of the trays in order to ensure that the instruments can be rinsed sufficiently. After the instruments have been disinfected, they are reassembled, maintained and checked if necessary. Here the employee carries out a visual check for defects and surface changes. During maintenance, for example, instruments are oiled on moving parts in order to maintain their functionality in the long term. This is followed by sterilization. The medical devices must at least be inserted into a so-called sterile barrier system. There are several possibilities here: sealable bags, sheets or sterilization containers. This ensures germ-proof and low-dust packaging of the medical products. If the medical devices are sterile, they are stored for later use. The preservation of sterility must always be defined by the user. This is significantly influenced by so-called events or changes. Constant ambient temperatures and reduction of movements are the key to long and safe storage. The proper reprocessing of medical devices also includes the documentation of all reprocessing steps. These must be fully documented for each medical device. In addition to the correct execution of the actual work processes, an increased bureaucratic effort is necessary, which is also defined by an established quality management system. Cleaning and disinfection, testing, care, sterilization, storage and documentation. These are only the processes that the RUMED carries out on an everyday basis. In order to ensure a smooth process, the RUMED management has to deal with other challenges. This will be one topic in our next video. Stay tuned!